Greetings and salutations. Thank you for lending an ear to The Voice of the Times this Tuesday, April 13, 2021. For today's editorial, From the Horse's Mouth, Chinese Vaccines Have Low Effectiveness. It must now be said, the skeptics and Sinovac naysayers have been right all along. The Chinese vaccines against COVID-19, be they Sinovac or Sinopharm, have low effectiveness rate and can reasonably be refused by prospective vaccinees on the grounds of efficacy and safety. According to the Associated Press, China's top disease control official has admitted to the weakness of Chinese coronavirus vaccines. Gao Fu, the director of the China Centers for Disease Control or CDC, says the effectiveness of the Chinese vaccines is low, and the government is considering mixing them to get a boost. Chinese vaccines don't have very high protection rates, he said at a conference in the southwestern city of Chengdu on Saturday. The official admission seems incongruous with the current primacy of President Xi Jinping as Chinese leader. Mr. Xi has been unbending and unyielding on his policy decisions even when they turn out to be duds, as with his missteps in claiming all of the South China Seas and building military structures on islands and reefs in the waterway. The question of the COVID vaccine, however, is not one of politics or power. It is a question of fact and science. It also involves matters of life and death, because public health is on the balance. Gao knows it. This is why he has spoken forcefully on the issue of the COVID vaccines as China's top disease control official. There is a vivid English idiom that underscores the significance of Gao's statement. That is the expression, getting it straight from the horse's mouth. According to the American Heritage Dictionary of Idioms, the idiom from the horse's mouth means this: if you get a piece of information from the horse's mouth, you get it directly from someone who is involved in it and knows most about it. McGraw-Hill's Dictionary of American Idioms and Phrasal Verbs is more pointed and concise. It says from the horse's mouth means from a reliable source on the best authority. Gao's admission is sure to affect China's vaccine diplomacy and competition with the Western vaccines. Beijing has distributed hundreds of millions of doses of the Chinese vaccines to foreign countries while trying to sow doubt about the effectiveness of the Pfizer-BioNTech vaccine, made using the previously experimental messenger RNA or mRNA process. The Chinese vaccines use the traditional adenovirus vectored vaccine technology. It's now under formal consideration whether we should use different vaccines from different technical lines for the immunization process, Gao said. Chinese officials at a news conference last Sunday didn't respond directly to questions about Gao's comment or possible changes in official plans, but another CDC official said developers are working on mRNA-based vaccines. The official, Wang Huaqing, said mRNA vaccines developed in China have entered the clinical trial stage. He gave no timeline for possible use. Experts say mixing vaccines or sequential immunization might boost effectiveness. Researchers in Britain are studying a possible combination of Pfizer-BioNTech and the traditional AstraZeneca vaccine. The coronavirus pandemic, which began in central China in late 2019, marks the first time the Chinese drug industry is playing a role in responding to a global health emergency. Vaccines made by Sinovac, a private company, and Sinopharm, a state-owned firm, have made up the majority of Chinese vaccines distributed to several dozen countries. The effectiveness of a Sinovac vaccine at preventing symptomatic infections was found to be as low as 50.4% by researchers in Brazil, near the 50% threshold at which health experts say a vaccine is useful. By comparison, the Pfizer-BioNTech vaccine has been found to be 97% effective. As of April 2, some 34 million people in China have received both of the 2 doses required for Chinese vaccines, and about 65 million received 1 dose. A Sinovac spokesman said studies find protection may be better if time between vaccinations is longer than the current 14 days, but gave no indication that might be made standard practice. Meanwhile, Gao's statement on the low effectiveness of Chinese vaccines should sink into our heads. And that's the editorial for Tuesday, April 13, 2021. For more news and information, get a copy of the Manila Times on print, subscribe to our digital edition, or log on to www.manilatimes.net. Follow us on Twitter, Facebook, and Instagram. And listen to The Voice of the Times.